on you. I'm now delighted to welcome to the stage University of Arizona President Dr. Bobby Robbins. And while he has a resume that is just beyond, I'm actually going to talk about one area, and that is that Dr. Robbins used to run the Texas Medical Center. And I'm actually stealing something from him, which is just the highest honor and compliment, because he made an art out of having a once-a-year Texas Medical Center state to the business community. So tonight is this our first inaugural State of the PBC, and so I am actually taking one of your best practices. So thank you. With that, please welcome to the stage.
Thank you, Scarlett, and good evening, everyone. I'll be brief. I had about 5 pages of notes, but I'm going to move us along. First, I'm here, Chairman Duvall, Regent Mata, Regent Brewster, Regent Goodyear, I don't know where you are, I can't see you. Executive Director Arnold, thank you all for being here. I have to cover my bases. They're my bosses, so thank you for coming out and learning more about this incredible place that when I first came here was about 8 years ago, and I went on a tour with Rick Neymark, who walked me around the PBC, and that was in the days when I was working with President Crow and the ASU team to try to better understand how could ASU better leverage all the incredible assets around health and wellness. Little did I know a few years later I would actually be here. And I'm very grateful to, I see you, Regent Goodyear, you're way back there. I am so grateful to be here, and I'm here to assure everyone that the University of Arizona is not only surviving, we're thriving. We have the #1 basketball team in the country. We have the 14th ranked football team that's about to go beat Oklahoma Sooners in the Alamo Bowl, and I just want my NAU colleagues to know that after the game against Wisconsin, I went with Coach Lloyd into his office where his wife was sitting there on her phone watching a game, and it was the NAU Lumberjacks against the University of the Incarnate Word in San Antonio, Texas. There were 3 minutes left in the game. 3 minutes left in the game, and if you didn't see it, it didn't quite make SportsCenter, but it came down to the last shot, and the NAU player hit it with literally 0.2 seconds left on the clock and made the shot to win. Why were we all watching? Because there was so much excitement, because number 21 who plays for NAU is Coach Lloyd's son. So that's the rest of that story. But I do pull for the Jacks and the Sun Devils, just not when we play them. But as Rick was walking me around, I knew this was a special place, and I think of Arizona as the future state. It's the future state of one of the 50 states of the United States, but it's the future state for many things. Scarlett mentioned the semiconductor industry. I really believe that we are the future state. We are the place for the health sciences, so that we can be focused and united on improving the health and wellness of all Arizonans and contribute to the country and the world with what is going to happen here. I want to thank so many people for, especially Governor Ducey, for believing in CAMI. Dr. Dake's going to talk more about CAMI. Marianne Cracchiola Mago is there, and she and the Steele Foundation took a bet on us and believed in us early. The other foundations, the City of Phoenix and Mayor Gallego, the Board of Supervisors of Maricopa County, everybody has come together to help us make this a reality, and we're really excited about that. But I'm very excited about this whole Phoenix Bioscience Core because of all the things that others have talked about. I will just say a couple of introductory words and then hand it over to Dr. Dake about CAMI. I've said this a lot, but when I think about the last 25 years, I think probably arguably one of the most important advances in health and wellness is the mapping of the human genome. And TGN was started, I don't know exactly what year, but I'm guessing within the last 25 years. And I would argue that what TGN has done, CAMI will do for the next 25 years. Now, TGN is going to continue to be an incredibly important collaborative partner that brings all of these entities, all of our universities, the healthcare providers. We're having a retreat. We have a dinner. We took a break from our retreat with our Banner colleagues, and Mr. Chairman, it's going quite well. We worked hard all day. We're going to have a nice dinner, and then we'll get back to work tomorrow. And then I have a Board of Regents meeting tomorrow. So it's an action-packed time here in Phoenix. But as I look at the future of unraveling the mysteries of health, I believe, and we're putting a bet on, that our immunological function is going to be the key to so many of the unsolved mysteries in health. Cancer, cardiovascular disease, autoimmunity, the aging. It appears there's some immunological effect on aging, and then of course the one that's most obvious is infectious diseases, having just come out of the pandemic. So we're very excited about what we're going to do, not only here with CAMI, but we're incredibly excited, and you'll hear from Dean Wondisford in just a minute when I stop talking, and it'll be very quickly, that we're glad, Fred, that you took a chance on the U of A and Phoenix and brought your talents to Phoenix. But I think this collective idea of using CAMI is sort of the tip of the spear of what, as many have said already, will hopefully be fundamental discoveries and translation of those fundamental discoveries into new therapies, new diagnostics, new biomarkers, new algorithms, and how we can treat these diseases that I've outlined. So I couldn't be more proud to be here, to be part of this, and to see where it's going to go over the next several years. So thank you all for being here. I hope you can be 1/10 as excited as I am, and I look forward to the second annual after this inaugural state of the PBC. Thank you.
Waste any time. Dr. Dake, will you please come up? We are so thrilled to have you here. Thank you so much. We have actually been waiting for an update on the exciting work that is happening. We know you've been just tirelessly working away at it, so we look forward to your update.
Thanks, Scarlett. And good evening, everyone. I'm this is special to see so many people interested in what's going on at the PBC. And now, President Robbins, in my limited time, I will try to trot through this. Great. And my remarks tonight are going to focus on two areas alluded to by Chair Duvall and President Robbins. And that's to further familiarize you with CAMI and also what the U of A is doing to address provider and workforce shortages in the state of Arizona to help improve health and benefit all Arizonans. So, first is CAMI. I'm sure some of you are familiar with at least the concept. I'm going to try and add some specifics to it that you may find interesting. CAMI, of course, is predicated on the basic principle that the most effective defense against health issues is the body's natural immune system. President Robbins talked about how this seems to be increasingly important in a variety of diseases, and we fully expect CAMI to be a national biotech hub that's going to advance knowledge of immunology in 4 key areas he outlined: cancer, infectious disease, autoimmune disease, and something that's sort of a cross-cutting initiative in sort of immune phenotyping or immune monitoring. Economic impact. We commissioned an economic impact report early on that we shared with a number of different municipalities, donors, et cetera. I won't go through all this. It's a significant project, probably the largest project President Robbins at the university has ever undertaken. It has a number of differentiating features, of which one is we're building a GMP facility within CAMI. GMP stands for Good Manufacturing Practice. That means we're actually going to, from our labs within CAMI, we have planned to have 40 actual principal investigators, so 40 labs. Through those 40 labs, we'll actually be able to manufacture agents that then go into phase 1 trials, not only for our labs, but throughout the valley. This is unique, and we're working with a number of very high-profile consultants, including Drew Weissman, a recent Nobel Prize winner, and we just had a group come back from Cape Town looking at Afrigen, which is our model. They're working with us that you may be familiar. Afrigen is something that WHO founded with $6 billion to build 17 labs around the world based on vaccines for infectious diseases. And indeed, in fact, mRNA vaccines will be the first target and the first manufacturing focus that we'll have at CAMI, followed thereafter by cell and gene therapy. Timeline. Well, we have some announcements. Announced today that the selection of the design-build firm for CAMI is Phoenix's own McCarthy and Smith Group, nationally recognized with a lot of experience and expertise in this area. But we're not waiting for them to build the building. Actually, in February of this year, and we will open in May 24, the second floor of the farthest north building on our U of A campus, which is the BSPB, and there's 15,000 square feet of shell space that's being built out. So CAMI will start there and then merge into the new building once it is ready for occupancy. Groundbreaking for the new building is November 24. Finalization of design will be in February 25, and the overall completion and move-in will be in July 27. These are just some, I won't hold anyone to these renderings, but it's meant to be an iconic structure that, as Scarlett alluded to, is meant to not only be a beacon to the community, but actually something that's going to embrace the community, inviting in. There'll be restaurants, there'll maybe be retail, et cetera, et cetera. Second part of my remarks is what are we doing to basically expand healthcare workforce in Arizona? Many people have talked about some of the deficiencies we have in our state in terms of we have lots of opportunities, but we also have challenges. Arizona needs anywhere from 500 to 667 primary care full-time physician equivalents to eliminate our current shortage. That's a big lift. We have many, and the areas that we really are focusing on include mental health and OB. We have many counties in the state that don't have any OB. This is important. And as you can see, for the fastest growing state, these discrepancies are only going to grow unless we address them now. So I'm going to go through what our college is doing. Just so you know, background, we have 6 health science colleges. The newest is the College of Health Sciences. This was just approved by ABOR in mid-June. It's addressing a lot of critical cares, predominantly in southern Arizona, where we have 5 graduate-level degree programs, including midwife, first midwife program in the state, physician assistant, doctor of physical therapy, genetic counseling, and clinical translational science. And again, any questions about this, I'll be around afterwards, but I'm going to pick up the tempo here a little. One of the things we're very proud of is working with the legislature. We started this in 2018, and our first class came in 2020, a primary care physician scholarship program, which covers students at both our medical schools in Tucson and Phoenix. The recipients must commit to practicing primary care in an underserved or designated underserved healthcare community in Arizona. That could be rural, but it could also be urban, and for every year they'll commit to that, their tuition is paid for. We have now we have 92 active medical students on full scholarship. That's incredible, and we every day appreciate what the legislature has done for us to make that happen. And we recently announced our new cohort of 25 physicians who have joined the program. We've had already receptions and networking opportunities for past graduates who are now going in the first class into their residency, but for current students who are just being initiated, 24 in Tucson and 11 here in Phoenix. Global MD program. This is another way we're trying to address healthcare workforce shortages. I won't get into the rationale and why this makes sense, but suffice to say, this was approved yesterday by the Faculty Senate. So we're very excited about this. First 2 years of basic science will be with our partner, the University of Western Australia in Perth. Second 2 years will be here in Arizona. We're going to start with 50 students. We'd like to scale up to 200 students. We hope that, as you can see here, by 2035, this will allow us to increase, with 630 graduates, the number to about 410 of primary care physicians in rural Arizona with a 65% retention rate. Exciting program. First class in 2025, first class to come to Arizona will be 2027. College of Medicine Tucson, we have a number of interesting programs. I'm not going to have time to really go into a lot of details, but a BS in medicine. This also joins our other BS programs that are in the College of Medicine Tucson, including pharmacology, emergency medicine, a new program we're launching, a BA in medical devices, which is sort of an innovative new program. The BS in medicine started in 2022, and we already have majoring 828 freshmen and sophomores. We anticipate this is just going to continue to grow till it's one of the top 5 majors at the university. Accelerated pathway to medical education. In brief, this is meant to be competitive with programs nationally which take students right out of high school and provide them with a BA and an MD degree in 7 years. We're doing one better. We're trying to make each one of these graduates get a master's and an MD in one of the 21st century, obviously, whether it's AI, biostatistics, bioinformatics, et cetera. We admit 5 students a year. We have over 600 applicants already. Honors Early Insurance Program. This is in association with the Franke Honors College. This allows students who are in the Honors College after their junior year to be accepted, provided they keep grades up. It's an early assurance. It gives them a sense of where they're going to be going and helps them focus on the future. 3-year medical doctorate program for primary care physicians. That's something that is I think there are only a couple other programs in the country that do this. This is approved ACGME program that allows, if you commit to primary care, instead of 4 years of medical school, you can come out in 3 years. Again, accelerating the tempo of medical education, especially in primary care where our shortages are the greatest. Now, as I mentioned, mental health and OB are big shortages, but there's no shortage that's more severe than nursing. And we've talked about that, and both ASU and NAU have mentioned how they're going to contribute to this. We have committed now over the next 5 years to scale up to 1,000 students. Our School of Nursing is primarily a graduate school, but we have now, this is all going to be undergraduate in BS in Nursing and BS in Nursing Integrative Health, which is, you may know, is in Gilbert, very strong program in Gilbert. And this was obviously really facilitated by a grant for the Arizona Department of Health Services. Ken Coit College of Pharmacy. We're the 6th rated among U.S. pharmacy schools in terms of NIH funding. With this very strong investigative foundation, however, please note that we have a very intense interest in rural health professions programs, such that we have 150 students currently in that program, which represents 29% of the PharmD enrollment. So a lot of emphasis on placing pharmacists out in rural areas. We know this makes a big difference. And again, the rural setting for pharmacy helps build that ecosystem within rural communities that's very strong in terms of an economic impact for those communities as well. Zuckerman College of Public Health. These are 2 new programs we started that are There's been a big boom in interest in public health with the pandemic and COVID. And our College of Public Health was right there in the middle of this, contributing to new programs, a BA in wellness and population health, and one of the first programs in the country, which is an MPH in climate change in health. You may not know, and I don't have time to get into it, but we're very interested in the escalating effects of climate change in health. We have a number of programs going on with CNRS, which is the National Science Foundation of France, in a number of areas in climate change. College of Medicine Phoenix, we're going to introduce our new dean who's going to talk about this, but I will say with our partner Banner, we've had very good success over the last year, increasing additional residency and fellowship positions by 229. That's over 10% of our entire GME portfolio has been increased in the last year. This will expand 3 programs and then build 16 new programs by 2027. So that's going to grow the number of specially trained physicians through this partnership by more than 60%. So in summary, the University of Arizona is addressing critical healthcare problems, educating the next generation of healthcare professionals to provide compassionate care and build healthier communities as part of our obligation to the state of Arizona. And now it's my pleasure to introduce Dean Fred Wondisford, who's been with us for 3 months, new on the job, but is going to give you his perspective on what the U of A is doing here in Phoenix.
So by design, there are no slides because I knew that I was going to be towards the end. So let me just start with something about me. So first of all, I'm not Frederick, because when I was Frederick, I was in trouble with my mother. So I'm a Fred, and as Mike said. The second thing is I grew up in Northeast Ohio, so I have to say unfortunately have this disease related to being a long-suffering Cleveland sports fan. And although I moved through 7 academic medical centers, I have not been able to shake this affliction. I'd like to say a little bit about what we plan to do here and make it kind of on simple terms so that, first of all, I can remember it, and maybe you can remember part of it. So I go by the R's, and what we're going to try to do, and just pardon me for a second as I go through it. So the first R, which is really important, and we've talked about it, is our relationships. Our relationships are critical to making the School of Medicine in Phoenix work. And that means that we can't train our medical students only with our main partner, which is Banner. We have relationships with Phoenix Children's, with Barrow, with the VA, with Honor Health, with Yuma, with Valleywise. They're all sites where our medical students train. And importantly, those sites all work together. So we think of ourselves as a nucleating force for a lot of disparate health systems. The second thing that's important is we're reorganizing to become more nimble as a school of medicine. What's exciting about this place, and in deference to President Robbins, they also took a chance on me. So he said, I took a chance on you. Okay, I say, you take a chance on me. We have a lot of development to happen here. Our school is 17 years old, and it's moved out of the startup phase, and it's now into the growth phase. And that's why I came. I saw growth. You heard about CAMI. CAMI is going to be right next door. Thankfully, it's not going to be quite as high as the 10th floor, which is where my office is. So I'm still going to have my view, so I'm told. Who knows? It might go higher. But there is other things here that are important in developing a school. We have resources. We have people that are interested in building. So again, very exciting for somebody that is interested in building. So beyond our reorganization, our resources, we are going to do much better with philanthropy. We're going to go out to the community and meet our partners, which I'm doing all the time. In fact, lots of dinners, lots of discussion. If we do all of these things, What will be the end result of that is recruitment, and particularly of researchers. So that will result in expanded programs, and we'll be able to serve our partner institution, which is going to be very soon CAMI. Our reach of the school is going to change. So we're going to expand our class just like Tucson and others. We're going to expand our class in primary care and rural health. We're going to offer a 3-year program, very much like Tucson. But importantly, we're going to try to address primary care shortage in Arizona, and by the way, nationally, that's the case. If we do all of these things correctly, our reputation will change. We will raise our profile within the city, within the state, and nationally. So I'm really very excited to be here. I know how to get back and forth from where I live now, so that's a good thing. And I think I'm pretty much open for questions if there are any, or closing the program, whatever.